No employer can sustain a double-digit growth in healthcare cost year after year after year in a system that we're in now, in my opinion, is destined to collapse.
America's healthcare crisis is a crisis of access, of care quality, and of rising cost. The crisis of affordability has created a shared interest among American businesses, labor unions, government leaders, healthcare providers, patients, insured and uninsured Americans in the reform of healthcare. Rising healthcare costs are not just a problem of affordability, they're an economic problem too. The rising cost of healthcare undermines the competitiveness of American business in the global economy and contributes to loss of good jobs at home. Recent data indicates U.S. manufacturers today pay more than twice as much for healthcare as their foreign competitors.
The reason General Motors is going under is because of health costs. It's $1,725 imputed to every car. There's no way we'll be able to compete internationally 10 years from now, 5 years from now, or 3 years from now unless we fix this. When healthcare has taken 17% of the gross national product on its way to 21%.
You know, when you have healthcare rising at a rate of sort of 2 to 3 times the rate of inflation, it's not sustainable. Having sort of healthcare costs equal the profits of a corporation does not make for better competition and better corporations.
35% of my union are registered Republicans. They are angry. They're losing their jobs, just like the Democrat members are. We're asked at every bargaining table to solve a national crisis. We can't do that. And until we can address quality and cost and find that there's a national solution, we're doomed to further erode the economy with conflict and strife and a continuing battle over the issue of health care.
A healthcare union, a healthcare union, a never die union, a never die union.
We're going to affect the economy, we're going to affect the employment, and we're going to affect the citizenry of America. We don't want that to happen. We've got to continue to work together, and I think much better on a bipartisan basis than on a partisan basis.